Everyone, welcome back to Good Day Columbia. And over half of the 24 million people who suffer from arthritis feel it in their knees. Part of the body we don't really think about until it hurts to walk, hurts to run, or maybe even bend over and pick up our kids. Now, the good news is that you can take care of your knees and maybe sidestep some of the knee problems. But if not, there are certain ways to be treated without even having to get knee surgery. And I'm going to tell you about that this morning from Doctor's Care, Dr. Thomas Gibbons. Tommy, right, sir?
Tommy.
That works for me. From Progressive Therapy, Barry Fitch. Good morning, gentlemen.
Good morning.
So let's first of all talk about our knees. It really is something you don't think about. They're just always there, but they're like a really intricate part of our ability to move around, right?
Well, yeah, it's one of those things whenever they start bothering you, that's when you realize how important they are.
Sure.
They can give you a whole lot of trouble.
So out of 24 million people with arthritis, half of them feel it right in here. So we really abuse the heck out of our knees through the years.
Yeah, it really accumulates on the knees. It's mostly a wear and tear issue. The more likely you're going to have arthritis is the fact if you live longer.
Sure.
So it's a good thing and a bad thing.
Arthritis, like cancer, a lot of things that happen to our bodies, a lot of things you can't really prevent it. But are there some things that maybe you won't prevent it forever, but stave off arthritis and sore knees, like behaviors that I could do, much younger than 60?
Oh, absolutely. There's a saying that motion is lotion. I mean, you just got to keep moving.
Right.
Flexibility, balance, strengthening, posture, those are all the things that help keep your knees healthy.
Oh, so you're not like leaning over and twisting your knees around, I suppose?
Just how you're, for instance, not so much for the knees, but how you're interacting with your computer. I mean, that kind of works on the back.
Yeah. They always say the body's all connected together.
It's all connected.
It's all connected.
Also sitting, as Americans, we tend to sit a lot.
Right.
Too much. Driving counts too. And that is a posture, repetitive posture, where the knees are bent and the hips are bent, so the knee flexors and hip flexors tend to tighten up.
Sure.
So that's one of the postural considerations.
Sure. Now, real quick, I want to talk just briefly about how they can be treated. I understand of course, you get new replacement surgery needs, but there is another option, right?
Yes, we call it viscosupplementation. I'll let Dr. Gibbons go from here.
What we do is first of all, we identify that person has knee pain and they have arthritis.
Right.
We usually do x-rays, talk about the program, but basically it's a series of 5 injections.
Okay.
It's hyaluronic acid. It's the same material that is actually made by your cartilage cells. So we do 5 injections. It's minimally or no pain. We do it under fluoroscopy. The beauty of that is it's 100% accurate that you're actually putting the product in the knee joint.
Sure.
Because there's a certain miss rate. It's up to 30-35% if you don't use that modality.
Right.
So we make sure we're getting it in there. We couple that with physical therapy. If you're just doing the shots, it's about 70% effective. If you're doing the shots and the physical therapy, you get up 86-90% effective as far as decreased pain, more functional.
Okay, so the physical therapy goes back into the motionless lotion.
Absolutely.
Guys, we've actually got to take a break, and there's a lot more I want to talk about, but we're going to put some links at midlandsconnect.com for some of the procedures and information, knee safety, and if folks are interested in getting some of that non-surgical stuff, and I like that non-surgical word as it goes. So get those, get the injections, you get physical therapy, but keep moving. All right, gentlemen, I appreciate you coming in this morning on a Friday.
Thank you.
Thank you.
You got it, guys. We'll get those links for you at midlandsconnect.com, and there's a lot more Good Day Columbia on the way. We'll get up and exercise the knees in a little bit. Stay with us.